Good morning, everyone. Today I'm going to present a seminar on disorders of memory. My moderator is Dr. Veena ma'am. Memory is a general term for mental process that allows the individual to store information and for later recall. Models of memory processing. First is Atkinson and Shifrin's information processing theory. According to this theory, the memory starts with the sensory input from the environment. This input is held for a very brief period of time in the sensory register associated with the sensory channel. Information that is attended and recognized in this sensory register is then passed on to short-term memory, where it is held for around 30 seconds. And some of the information reaching short-term memory by the process of being rehearsed a lot of time is stored into long-term memory. Second model is working memory model by Baddeley and Hitch. In 1974, Baddeley and Hitch proposed a working memory model which replaced the concept of general short-term memory with specific working memory. This consists of three stores: central executive, phonological loop, and a visual spatial sketchpad. And in the year 2000, it was expanded to include an episodic buffer. The central executive store is located in prefrontal cortex. It channels information to phonological loop, visual spatial sketchpad, and to the episodic buffer. The phonological loop, the visual spatial sketchpad are the rehearsal system for retaining visual, spatial, and language aspects of the stimulus. The episodic buffer acts as a link information across domains to form integrated unit of visual, spatial, and verbal information and chronological ordering. The working memory model explains many practical observations, such as why it is easier to do two different tasks like verbal and one visual than to do two similar tasks. Third is level of processing model by Craig and Lukart. This suggested that more deeply information is processed, the more likely it is to be retained. They argued that the process could lead to some long-term learning, but that the amount of learning depend on the type of processing. The deep processing in terms of meaning leading to better retention than shallow processing. Maintenance rehearsal might keep material available, but would not enhance long-term memory. Now, stages of memory processing. First is encoding or registration. It is process of receiving sensory input and transforming it into form or code that can be stored. Second is storage retention. It is a process of actually putting the information into memory. Third is retrieval. It is capacity to access the stored information from memory by recognition or recall. Then what is recall? Recall is effortful retrieval of the stored information into consciousness at a chosen moment. Example, when somebody asks what is the capital of India, it requires recall function. Then recognition. It is retrieval of the stored information that depends on identification of the item previously learned and is based on remembering, that is effortful recollection and knowing. Familiarity based recollection. Example, when somebody asks what is the capital of India and give you cues like Delhi, Mumbai, Lucknow, this text has recognition function. Now, based on the duration, memory is classified into sensory memory, short-term or working memory, and long-term memory. The long-term memory is further divided into explicit memory and implicit memory. Explicit memory, also known as declarative memory, and implicit memory is procedural memory. Declarative memory is again divided into episodic memory and semantic memory. First is sensory memory or sensory register. It is primarily a selecting and recording system that comes into play in early phase of memory formation via perceptions like auditory, visual, touch, taste, etc. enter the memory network. When the visual stimulus is registered as an exact replica, it is iconic image and it lasts in our memory register for about 1 second. When an auditory stimulus is registered as an echoic image and it lasts for about 4 to 5 seconds in our sensory register. We pay attention and recognize some of the information in the sensory register. This attended to information is then converted to short term. Now, short-term memory or working memory. It is capacity for holding small amount of information in mind in an active, readily available state for a short period of time. It is held for about 30 seconds. For example, if you saw a person walking a dog and a few seconds later heard a dog bark, you would not be surprised since you would identify that likely source of the sound from the sensory memory that had been processed and encoded in short term. Then is long-term memory. It provides lasting retention of information and skills for minutes to lifetime and has limitless capacity. It is divided into explicit, declarative, or relational memory, implicit, or skill memory. First is declarative, explanative, or relational memory. It encompasses all the information that we can consciously describe or report. In this, the area of the brain involved is hippocampus and the medial temporal lobe. It is divided into two, episodic memory and semantic memory. Semantic memory is memory about abstract use of our language possible. That it consists of knowledge about the words, what they mean, how they are related to each other, and what are the use of using them in communication and thinking. Second is episodic autobiographical memory. It consists of long-term memories of specific thing that happened to us at a particular time or place. Example, your wedding day. It is characterized by general recall of the event, interpretation of the events, and recall of few specific details. Implicit or skill memory. It refers to skill, habits, and other manifestations of learning that can be expressed without an awareness of what has been learned. It is unconscious memory abilities. It is divided into procedural memory, priming, and simple classical conditioning. In procedural memory, there is no active awareness that the memory is being surged in undertaking a particular skill. Example, riding a bicycle or driving a car. This type of memory is processed in striatum of brain. Second is priming. It is non-conscious form of human memory concerned with perceptual identification of words and objects. Example, if a person read a list of words that includes a word table, and if later asked to complete a word tab, the probability that he or she will answer table is greater than if they are not right. The area of brain involved in priming is neocortex. Then is simple classical conditioning. Simple classical conditioning is another type of declarative memory that generally occurs in presence of conscious awareness of conditioned stimulus, that is ringing a bell, and an unconditioned stimulus, that is food, but can occur without awareness also. This type of memory is dependent on amygdala, that is related to our emotion, and also to cerebellum for motor responses. Now there is a phenomenon known as tip of the tongue phenomena, which indicate that the information is organized in our long-term memory. Suppose you are trying to retrieve a person's name, but you cannot quite remember it. The name is on the tip of your tongue, but you cannot recall it. In tip of the tongue state, we try to retrieve it from our long-term memory. So we tend to retrieve words which sound like a target word or which start with the same letter as the target word, which contain the same number of syllables as the target word and has a meaning similar to target word. For example, while trying to write the child was abandoned by the parents, we wrote that the child was absconded by the parents. This is tip of the tongue phenomenon. Forgetting. Forgetting refers to apparent loss of information already learned and stored in long-term memory. Forgetting is based on interference theory, which is proactive interference and retroactive interference. In proactive interference, old memories interferes with ability to remember new memories, and in retroactive interference, new memories interfere with the ability to remember old memories. Interference is stronger when the material is similar. Now, clinical classification. Clinically, we divide memory into immediate memory, recent memory, and remote memory. Things to keep in mind before clinical memory evaluation. First, the patient should have a sustained attention. Inattentive, distractible patient cannot perform the memory test properly. Patients who cannot perform optimally these tests are patients who are in acute confusional state, patient with psychotic disorders, usually they have impaired attention, deaf patient, aphasic patients, or anxious patient, depressed patient, which may reflect memory impairment, but which is secondary to their which is secondary to their these states. Immediate memory. Immediate memory is used to recall a memory trace after an interval of few seconds. It is usually done by digit repetition test. Here, the patient repeats the number as read to him or her by the examiner. The directions are the digits should be presented in normal tone of voice at a rate of 1 digit per second. You should not group the digits in pairs, or sequence should not be sequence that could serve as an aid to repetition. Example, a phone number. Numbers are presented randomly without any natural sequence. Score. Normally, a patient with an average intelligence can accurately repeat 5 or 7 digits without difficulty. In a non-retarded patient without obvious aphasia, inability to repeat more than 5 digits indicate defective attention. Second is recent memory. Recent memory is patient's capacity to remember day-to-day events, like current date, doctor's name, what was eaten for breakfast, or recent news event. It is ability to learn new material and to retrieve that material after an interval of few minutes, hours, or days. Orientation or recent memory is tested in a sequence by asking the patient firstly about his name, age, date of birth, secondly the place where he is currently residing in terms of name of the place, kind of place, floor, city, state, country, his home address, and lastly testing the time domain comprising of date, day, time, season of the year. Usually normal people score perfectly right in these domains. The people who are not high school educated may make a mistake of plus minus 2 days in recalling the date, and those who are high school educated may make an error of plus minus 1 in recalling the date. Or you can simply ask these questions like कल रात को आपने क्या खाना खाया, या आपने नाश्ते में सुबह क्या खाया, इस महीने का क्या नाम है, या आज कौन सा दिन. Remote memory, these tests evaluate the patient's ability to recall personal and historic events. So you can ask the questions like कि आपकी उम्र कितनी है, आपका जन्म कहाँ हुआ, शादी कब हुई, आपकी नौकरी या व्यवसाय करना कब से चालू किया, पिछली बार आप इस विभाग में कब आए. Next is new learning ability. In new learning ability, you have to instruct to the patient that you are going to tell 4 words that you would like to remember, and in a few minutes I will ask you to recall these words. To ensure the patient has heard, understood, and initially retained the 4 words, we gave him 4 words. We have to repeat the words immediately and to correct if any errors. Then he is asked to recall the words after 5 minutes, 10 minutes, and 30 minutes to eliminate any possible mental rehearsals. Interference should be used between the presentations and the recall of the words. You can use some unrelated words like chata, fool, ghadi, tasveer, pencil. Scoring: normal person accurately recall 3 to 4 words after 10 minutes of delay. If some after being reminded of the correct words by verbal cues, whether he or she recognizes the appropriate word from the series of words, and improve their performance after 10 to 30 minutes, may be seen. But in patients with dementia, this improvement in the performance is not seen. Then are memory disorders. Memory disorders are broadly classified into amnesias, paraamnesias, and hyperamnesias. In amnesia, there is loss of memory. In paraamnesia, there is distortion of memory. Amnesias can be further divided into psychogenic amnesias and organic amnesias. Psychogenic amnesias are childhood amnesia, dream amnesia, defensive amnesia, anxiety, catathymic, and dissociative or hysterical amnesia. Childhood amnesia. Freud used the concept of repression to account for childhood amnesia. He said that we are unable to retrieve childhood memories because they are associated with forbidden arousing sexual and aggressive urges. And according to Sechel, there are different ways of using ways young children and older people encode and store information. Adults store information in language form, while young people and people without language encode information in the form of images and feelings, which are difficult to retrieve. That's why we are not able to retrieve childhood memories. Second is dream amnesia. According to Freud, he again used the concept of repression to account for dream amnesia. He said that dreams are dreams to be expression of forbidden sexual and aggressive urges. These urges have capacity to generate guilt, anxiety feelings, hence are difficult to retrieve. Another concept of state-dependent memory. In this, according to this, if people encode and store information in a particular emotional or drug state, they may not be able to retrieve the information in another emotional state. Example, when an alcoholic who were under the influence of alcohol, when they hit the bottle, then they forget where they put it when sober, but remember when drunk again. In dreaming, brain seems to be in a spatial state different from that of waking. That's why dreams are difficult to remember. Then there is catathymic amnesia or motivational forgetting. It is inability to recall a specific painful memory and is believed to occur due to defense mechanism of repression. In this, there is no loss of personal identity as occurs in dissociative amnesia. Then is dissociative amnesia. This is sudden amnesia that occur during period of extreme trauma and may be concerned about the stressful or traumatic life event that may last for hours or even days. Amnesia, in this, the amnesia is for personal identity such as name, address, history, as well as personal event, while at the same time, ability to perform complex behaviors is maintained. Dissociation may be associated with fugue or wandering state in which the subject travels to another town or country and is often found wandering and lost. There is no demonstrable anterograde amnesia in this type of amnesia. Then is defensive amnesia. It is a way of protecting oneself from the guilt or anxiety that can result from intense, intolerable life situations and conflicts. The amnesia will be for personal identity such as name, address, history, as well as personal event. The difference between defensive and dissociative amnesia is that in defensive amnesia, there will be a memory gap for the amnesic episode. Then organic amnesias. They are referred to as true amnesias and can affect different functions of memory. There can be impairment in registration, retention, retrieval, recall, or recognition. In anterograde amnesia, there is impairment in registration or encoding of the information as seen in delirium or epilepsy. In retrograde amnesia, there is impairment in retention, as seen in acute head injury. In confabulation, there is impairment in retrieval of the information, as seen in Korsakoff syndrome. And then impairment in recognition is seen in Alzheimer's disease and in schizophrenia. Confabulation is falsification of memory occurring in clear consciousness and associated with organic pathology. It manifests itself as filling in gaps in the memory by imagined or untrue experiences. It can be of two type, embarrassed type and fantastic type. In embarrassed type, the patient tries to fill the gap in memory as a result of awareness of deficit. These are real memory displaced in time. And this is more common. In fantastic type, the gaps in the memory are filled by detail exceeding the need of the memory impairment. And these include fantastic detail that never happened. In embarrassed type, the memories are real, but they are displaced in time. But in fantastic type, the details, there are details that never happened. Then some amnestic syndromes. In Korsakoff syndrome, it is irreversible residual syndrome caused by severe thiamine deficiency and occurring after incomplete recovery from Wernicke's encephalopathy. There is severe memory impairment characteristic primarily in the declarative memory. Within the declarative memory, both episodic and semantic memories are affected. In each of these subdomains, anterograde memory process are more severely affected than retrograde. The individual also have a flattened effect, apathy, lack of illness insight, and fantastic confabulations in the early stages. These are, but in Korsakoff psychosis, there is a Korsakoff syndrome. There is preserved attention, personality, social functioning, short-term memory, and non-declarative memory. Transient global amnesia. It is characterized by relatively circumscribed deficit in long-term memory. There is inability to learn new material. It appears that transient amnesia is caused by temporary bilateral dysfunction of medial lobe structures, including hippocampus, entorhinal cortex, and parahippocampal gyres. It occurs in middle-aged and elderly men and more commonly than women. And these patients normally improve spontaneously within few hours. And clinically, they can be assessed by recall and recognition tests that require retrieval of the recent learned information. Then paraamnesias, these are distortions of memory. This occur in normal subject due to process of normal forgetting or due to proactive and retroactive interferences from a newly acquired material. It can be divided into distortions of recall and distortions of recognition. Distortions of recall, first is retrospective falsification. It refers to unintentional distortion of memory that occurs when it is filtered through a person's current emotional or cognitive state. Example, in depressive illness, people describe all the past experiences in negative terms due to impact of their current mood. So a depressed person will highlight their failures while ignoring and forgetting about their success. Next is retrospective delusion. It is found in some patients with psychosis who backdate their delusion in spite of clear evidences that the illness is of recent origin. Example, a patient will say that he has always been persecuted, although we know that the illness has started recently. Then is delusional memory. Delusional memory is primarily delusional experience taking the form of memory. Schneider divided delusional memories into delusional perception and delusional ideas. In delusional perception, there is two-memberedness present, and in delusional ideas, it is absent. Example, when a patient says that they are of royal descent because they remember a spoon they used as a child as a crown on it, there is a memory and a delusional perception. Delusional meaning to it. While in delusional idea, when a patient say that they are of royal descent because when they were taken to the military parade as a small child, the king saluted them. There is a memory, but there is no delusional meaning to it. And then there are false memories. These are recollection of events that did not occur, but individuals subsequently believe that they did take place. It entails a person to construct a memory around an event that did not take place. Then is screen memory. In screen memory, the recollections are partly true and partly false. Example, an individual recalls that the childhood sexual abuse was done by the neighbor because it is too painful to recall that sexual abuse was done by their own. Then is pseudologia fantastica. These are confabulation that occur without any organic brain pathology, such as in personality disorders of antisocial and hysterical type. It is also known as pathological lying, mythomania, or morbid lying. Patient will describe the various major events and traumas and make grandiose claims which are often present at the time of personal crisis. Then syndromes related to pseudologia is Munchausen syndrome. It is a variant of pathological lying. In this, an individual present to the hospital with bogus illness, complex medical histories, and often multiple surgical scars. And Munchausen syndrome by proxy is when patient produces factitious illness in someone else, generally a child. Then is Ganser's syndrome. Ganser in 1989 described a set of symptoms which include approximate answers. The approximate answers suggest that the patient understands the question but appears to be deliberately avoiding the correct answer. Example, when asked how many eyes does the cat have, patient will answer 3. In Ganser's syndrome, there is clouding of consciousness present. While if the patient is consciously phasing illness, such as malingering, consciousness is clear. The cryptoamnesia. It is experience of not remembering that one is remembering. Example, when a person writes a witty passage and does not realize that they are quoting from passage that they have seen or read elsewhere rather than writing some original. Now, disorders of recognition. Disorders of recognition, there is deja vu that comprises of feeling of having experienced a current event in the past, although there is it has no basis in fact. The opposite of deja vu is Jamis view. In this, the knowledge that the event has been experienced before but is not presently associated with appropriate feeling of familiarity. Then there is deja intendo is a feeling of auditory recognition, and deja pense is a new thought recognized as having previously occurred. So this is similar to deja vu, but in a different modality. Misidentification. This may occur in confusional psychosis and acute chronic schizophrenia. Misidentification may be positive or negative. In positive misidentification, the patient recognizes strangers as his friends, relative, even though there is no physical resemblance. Some patients assert that all of the people whom they met are double of the real. In negative misidentification, the patient insists that the friend relatives are not the whom they say they are, and they are the strangers in disguise. Misidentification syndromes are Frigoli syndrome and Cabras syndrome. Uh, uh, Frigo, Frigoli's in Frigoli syndrome, hyper-identification takes place. The patient identifies a familiar person in various strangers who are therefore fundamentally the same individual. And in Capgras, there is hypo-identification. The patient insists that the particular person, usually somebody with whom the patient is emotionally linked, is not the person he claims to be, but is really a double. It is commonly seen in schizophrenia. And last is hyperamnesia. It is opposite of amnesia and paramnesia. There is exaggerated retention, registration, retention, and recall. Flashbulb memories, these are usually vivid, detailed, and long flashbacks that are associated with cognitive and emotional experiences of traumatic event. Example in 9/11 bombing witnesses. And second is eidetic images, which are exceptionally vivid images that occur immediately after any type of perception. These are more common in children than in adults. These are my references. The anterograde amnesia is something that occur, amnesia for the events that occur after a particular accident or brain injury, and amnesia for events before that is retrograde amnesia. Sir, in retrograde, in acute head injury patient, in acute head injury patient, there is retrograde amnesia. The person is not able to remember the events that happened before he came to the hospital. Before the accident, what happened before the accident, he is not able to remember this. This is retrograde amnesia. In anterograde amnesia, person is not able to form new memories. Something that happens after.
It is one of the things that makes ECT less scary to the person because he usually forgets the events around him. Because before what was happening, before he was giving ECT and just after, like nowadays we are giving body part. But even in direct ECT, the person, like you know, force him, take him, and you know that only event is connected, but he usually forgets. Just before the ECT and after, usually also retrograde, anterograde. That's how we also these are taken for classification of injuries. How severe the injuries. It depends upon how much is the retrograde amnesia and anterograde amnesia. So positive and unconscious. Obviously, you do not have memory for that. In this case, consciousness. So what is the anterograde amnesia? After head injury, when did he regain full consciousness? When he did. You ask how when you became aware, how much time it passed. What is the retrograde? Like you have to even remember where I was going. I was on a bike or a car. So it can be there. Retrograde and anterograde. These are the Rina is a model. How do we memorize what your needs?
By repeated rehearsals and associating
Use sometimes memory something blocks use of and there is one more thing called primacy and sensation.
presented a list of words. If you are presented a list of words, so the ability to recall the first word, this is like primacy. Initial first word is primacy, and the ability to recall the last words is recency.
Generally, the middle words are often gone. You remember that the initial part and the last part. Mostly we do. Different words we have to very easy to tell that they can explain. It's very easy to tell that.
For example,
Example,
we were playing lawn tennis only. I knew lawn tennis only. And now I'm trying to learn squash. So my ability to learn squash will be hindered by my lawn tennis players. This is proactive independence. And the opposite of that is
Skate fighters, they have very great difficulty in flying gliders. तो ये जो glider पे होता है ना, short plane होता है. They have great difficulty in flying those planes because the controls are just different. Okay, like if you अगर automated हो गया पर वो जो उनका flap होता है वो ऊपर नीचे होने से डायरेक्शन प्लेन का चेंज करता है. That is opposite in the these field planes, you know, वो जो field में वो करने के लिए pesticide वगैरह करने के लिए करते हैं. So it is glider is totally different. Glider को जब हाँ यहाँ पे जैसे नीचे करोगे साइड पे तो साइड पे वो करेगा, जबकि प्लेन में उल्टा होता है कि आपको वो विंग ऊपर को जाता है, वो फ्लैप जिस साइड का फ्लैप नीचे होता है उस साइड का विंग ऊपर होता है. It's even scrolling, you see that you scroll the word document in your phone, you scroll downwards, and in the computer you scroll downwards, and it doesn't go down. Yes. It goes up. So it becomes difficult. So that is why you are used to, you can say, some of that. So you can scroll easily on the mouse. Many people like they use mouse, although they have touchpad, because scrolling the mouse is easier. It's solved a lot with mouse, so that is easier than touchpad. And those with touchpad, then they will have a very automatic.
the limbic system of developed attachment. So like emotionally charged events are never used for long term. Because of amygdala. Limbic system also plays a very vital role. But cortex वगैरह तो है, but the limbic system also has a role. हाँ.
एक जगह पे यूज किया retarded TikTok retarded people don't have this, so we don't use it for retarded.
Stop using adjectives like manic, alcoholic.
Even now they can change the grammar also into retarded. So intellectually disabled.
Patients with this, subjects with this.
Yes, adjectives we should always schizophrenic, manic. Okay.
यही वाला चीज पे पूछ रहा है मुझे उस अभी तक कुछ क्लियर हुआ है कि नहीं उस बारे में.
हाँ 11 बजे
ऑनेस्टली बोल दिया नहीं यार. एक्चुअली सर ये एग्जांपल बड़ा ही कंफ्यूजिंग एग्जांपल दिया है सर. तो मैंने जो इसका निकाला है मैं आगे लेते हुए याद है.
ये केस सिनेरियो बता रहा हूँ, आप पता है क्या है. ठीक है, एक 19 years female, okay, unmarried, she have मतलब she has मतलब fantasies of dreaming sensation of she has one family, married, ससुर सास है ना, उनका सब कुछ है. रोज भाभी को कॉल कर रहा है, सास को कॉल कर रहा है, नया नंबर से कॉल करते रहता है. ठीक है, इसलिए उनका बाप माँ को बहुत कंप्लेंट भी है, ओपीडी से आ रहा है. आपको क्या फील हो रहा है, ये सिनेरियो में क्या फील हो रहा है?
नए नंबर से कॉल किए जा रहे हैं.
हाँ, मेरा इनलॉज है, मेरा ससुर है, लेकिन उसके सच में सोच रहा है मेरा शादी हो गया ससुर है मेरा अलग फैमिली है वो दिल्ली में रहता है ये सब क्या प्रयास है
तो उसमें कितना बात है ये वाला चीज बात ये हमारे जो डिविजनल ये वाला बहुत सर एक्चुअली आयुष्य में आई कुडंट आंसर दैट so I have read and I have very found something but I don't know if that's correct about this thing वो slide एक बार दे दो so उसमें लिखा हुआ है delusional memory perception और sublutional idea जो कि आई थिंक स्नाइडर ने डिवाइड किया था कि डिल्यूशनल मेमोरी को दो हिस्सों में डिवाइड किया और जो यास्पर का ये मानना नहीं था यास्पर ने बोला था कि प्राइमरी डिल्यूशन चार प्रकार के होते हैं सबको इंडिविजुअल मिला था स्नाइडर का ये वाला स्नाइडर के एग्जांपल में लिखा हुआ है यहाँ पे पूरा नहीं स्नाइडर के एग्जांपल में लिखा हुआ है डिल्यूशनल मेमोरी में टू मेंबर्स है जैसे कि फॉर्म पेपर वाला था उसमें कुछ ग्राउंड बना हुआ था ये क्राउन बना हुआ था तो इसलिए वो रॉयल डिसेप्शन है तो इसमें बोल रहे हैं कि जो क्राउन बना हुआ था ये तो सही में मेमोरी था और अब वो डिल्यूशनल मेमोरी में टू मोमेंटलेस हो गया अब डिल्यूशनल आइडिया में बताते हैं कि ये रॉयल डिसेप्शन के इसलिए थे क्योंकि इनको स्मॉल चाइल्ड जब थे तब मिलिट्री पेरेंट ने लेके गया था किंग सैल्यूट किया अब सर डिफरेंस क्या है मेमोरी में क्या मतलब memory is not true then memory is not true इसी बुक पे लिखा हुआ है कि डिल्यूशनल मेमोरी है मेमोरी ट्रू भी हो सकता है फॉल्स भी हो सकता है इसी बुक पे लिखा हुआ है they have gone to the parade soluted that's what I'm saying sir what लेकिन मैम डिल्यूशनल मेमोरी इसी बुक में लिखा हुआ है इसी में लिखा हुआ है और डिल्यूशनल मेमोरी में जो मेमोरी है हाँ वैसे तो वो फॉल्स हो सकता है ट्रू भी हो सकता है तो फिर ये अलग कैसे हुआ या तो स्नाइडर अलग सोचते होंगे और पिछले जो उस पैराग्राफ में लिखा है वो अलग है ये पिछले बहुत बार हुआ है एक बार एक दे दिया स्नाइडर या जैसा का फिर दूसरा एक इंटरप्रिटेशन दे दिया ये तो बहुत मतलब राइट था मेरा ये perception delusion is different and the perception is different so the perception is true for example that he did have a spoon with a flower it is true and there is no pathology morbidity in that okay so later on he developed a delusion the second there within the memory there is a illusion. There is no true memoriness. The memory may be true, but the perception is built within. Okay, so for example, that there is a memory that they went to a parade and the king saluted. In that only there is this perception that it is inbuilt in that experience. The memory may be true, but the perception उसी time का वो आज का नहीं है. So that is it is what I have understood. But it is very so what Sir is telling is basically this. That in that example, in the first example, the crowd has been built, and that is true. And now, in the 10 years after, when he's developing the vision, he's telling the Ram of Royal because the crowd was built. Fine. But here, it is that 10 years back, there was a parade. I had gone there. He saluted me. But that time, I think that the king had saluted me because I was of royal descent. So the delusion is contained within the memory. Also, like as you said, it could be true, it could be false. He may not have even gone to pray. That is possible. लेकिन सर उसमें वही पैराग्राफ इसका कॉन्ट्रडिक्शन हो जाता है वो पैराग्राफ में क्या है डिल्यूशन मेमोरी नहीं आपने कौन सी लिखी पढ़ी है वो पुरानी पुरानी वाली पढ़ी है उसमें और भी एग्जांपल है और भी एग्जांपल है we can discuss it later. What final difference? What final difference? What difference? एक क्वेश्चन जो सब लोग कि how do you assess memory if a valid informant is not? Check report कैसे करोगे? How do you do? No? Recent report का हो जाएगा, registration default हो जाएगा. हाँ, तो ये तो एक जो है जैसे कि हमारा 120 जनवरी का वार्ता काम करते हैं, तो ये तो हर साल आता है. मेमोरी कैसे चेक करोगे उससे? You are in right direction, but how to check the memory? How do you check the memory? That that is repetitive history in the past. You ask memory is a so you have to ask. You say कि आप उसको जब वो भी प्राइम मिनिस्टर बना तो आप कहाँ आपने कहाँ पे बोलते हैं? आपने ये न्यूज़ कैसे कोई ओल्ड पर्सन आपने वो न्यूज़ कैसे 26/11 जब इंसिडेंट हुआ था या जब यहाँ पे आपदा आई थी आप उसमें था, ठीक है? You also detail. You see the whether that matches. वो कंप्लीट करेगा या करेगा नहीं मुझे याद ही नहीं. आपके पास जो इंफॉर्मेशन है उससे आप कर सकते हो, थोड़ा बहुत पता होगा कि कहाँ पर रहता था, क्या क्या मिलता था, क्या पता नहीं चला. यार जो है मुझे आपको पता पाएगा, वेरीफाई तो शायद नहीं कर पाएगा, कंप्लीशन करेगा तो नहीं कर पाएगा, टैबलेट भी करेगा तो वो इंफॉर्मेशन से ऐसे कंप्लीट करेगा कि वो जो है रिसर्च इंफॉर्मेशन डाल देगा. ना उसमें मान लो कि कोई बार बात में 60 ईयर ओल्ड सब्जेक्ट है, वो कहता है कि मैं उससे जो है आई वाज वेरी यंग, आई वाज गोइंग टू कॉलेज, दैट इज कंप्लीट दैट यू लाइक लाइक वो क्या आपने 12th का पास है तो भी बता देना कौन सी स्कूल से पास करता है, रिजल्ट होता है, उसके बाद कैसे आपके पेरेंट्स का क्या रिएक्शन था, these kind of things. Because you remember these things. When your son was born, this hospital was born, who was with you, who was not with you, okay, was you, how many days did you stay, okay, when your wife went into labor, who took her to the hospital, were you there? So these kind of details somebody personally remember. So you take hookup of the last those events and then you try to see whether he can tell what information. Okay, when you collaborate with whatever history has given, whatever history you have, usually ऐसा होता है कि जैसे कि सन ले आया फादर को, उसके इवेंट्स हमको नहीं पता, कुछ तो पता ही होगा उसको, okay? या पास की जैसे कि वाइफ फैलाई, उसको पता नहीं क्या 4 साल 5 साल पर वाइफ को ये तो पता नहीं कहाँ कहाँ नौकरी किया, डिटेल्स बताओ. You can that way you can collaborate. Recent और बुक रजिस्ट्रेशन की कॉल एक्सेट्रा तो वही रहेगा, वही रहेगा, रिसेंट भी वही रहेगा. ठीक है.
What I mean, what material cost the gas.
The discussion.
That's good.
Those last parts of these are different results, very confusing to learn. You can just take examples and that's what you do that. Maybe that's what you very confusing for all. It's almost similar.
Presented well. कि बैनर जो है उसको कुछ करना पड़ेगा. ये ड्राइंग अभी देखो अभी ड्राइव हो जाएगा. So you do it in the beginning of the presentation. Write it down. ऊपर से तो प्रोसेस जाएगा, या तो उसको दूसरी विंडो में दूसरी विंडो में कर दो, that way you can, because the headings are hidden. ठीक है, ओके, और यहाँ पे टेक्स्ट declared support, ठीक है, ओके.